being here today. So my name is Tom King, and I am the campus blood donor recruiter. So I work primarily out of Ackerman. I was here and I came back, and I'm grateful to be back, and I see some familiar donor faces here on the screen, which is fantastic. And just to give you a little background, we have the Ackerman Center. We have a center on Gailey in Westwood, and then we do a lot of community drives and high school drives. We are the largest hospital-based donation center in the country, which is pretty awesome, and which means that everything we collect stays at our hospitals. So it goes to Ronald Reagan, to the Children's Hospital, or to UCLA Santa Monica. And generally, we collect about 80% of the products that our patients need, but during COVID, that dropped significantly. So we've been really grateful, especially I know at both centers and in our drives, that there's been a real outpouring. People have, especially with the students back, really helping us to help meet our goals and meet the needs of our patients. So today, though, you're going to find out a little bit more if you've been a regular donor or not. Just where does that blood go, or where do the platelets go after we collect them? So I'd like to introduce Dr. Dawn Ward, who's going to do that, because I don't know a lot about that. And she is the medical director for the Blood and Platelet Center, and also associate medical director of the Transfusion Medicine service. And so, Dr. Ward.
Thank you, Tom, for the introduction. And you actually know more than you think you know. So next time you'll be giving this presentation. Thank you all for joining us today. It's really exciting to see everyone that's here because it just shows that you're willing to learn more about blood donation. And it's a great, blood donation is a great opportunity to give back. And we have some guests with us today that will also share some experiences and their role in helping our center as well. But I'm going to go ahead and get started, and I have a brief presentation to share. Let me just pull it up. Let's see here. Let's see if I can do this the right way. Okay. Can you see slides or the slides and notes?
We can see the slides.
Just the slide. Okay. Because sometimes I mix it up and then you can see the slides with the notes. Okay, great. So Tom introduced me, so I'm going to just go ahead and get started. So today I just want to tell you a little bit about transfusion medicine and that area of medicine. Not too many people are aware of it. Then I'll provide an overview of UCLA Health. We'll describe the different blood components, review UCLA blood transfusions and collections, and then describe how you can become a blood donor yourself. And we have this hospital-employee partnership, and also just some of the brief donor eligibility. So transfusion medicine is actually made up of 3 different sections or divisions. There is the donor section, and that's actually when we have healthy donors coming in to donate blood. And the process is recruitment and screening. As I mentioned, we'll kind of go through a little bit of that. Then we also have the actual collection and processing section of transfusion medicine. So after we collect your blood, we can fractionate it or manipulate it in some way so that we have different blood components for our patients. And then the patient is the third part of transfusion medicine. And on the patient side, that's really patients that require blood transfusion or platelets or some of the other blood components, and ensuring that we give them compatible units and ensuring that there's no adverse events from those transfusions. And some people require some people's requirements are much more challenging than others. It really just depends upon the patient's underlying disease or disorder, if they have antibodies to red cells, etc. So there's a physician that kind of manages all three of these different sections, and it's underneath the umbrella of transfusion medicine. So that's what my fellowship subspecialty training was in, transfusion medicine. Okay, so let's there we go. So let's just talk about whole blood and how you participate in this journey of blood. So as a donor, when you come in to donate, if you are donating whole blood, we essentially collect blood into a bag that contains red cells, white cells, and platelets. There's also anticoagulant in there because we don't want that bag to form into a clot, right? So as we collect it, then we cool it down to our storage temperatures, which is 1 to 6 degrees Celsius. And in that process, we also will filtrate the blood, or what we call as leukoreduction. So we will remove the white cells from that whole blood red cell unit. Next, we spin it, the unit, and we separate according to density. And so the red cells fall to the bottom of the bag after centrifugation, and the liquid part of the blood, the plasma, remains at the top. And at this point, we can separate those two, and this can become two components here. So as we separate, we'll have our plasma unit here. This is essentially the liquid part of your blood. And then we have a packed red cell unit as well. So these are two separate units that can be used for patients at this point. And as you are aware, red cells contain hemoglobin. Hemoglobins are the major carriers for oxygen throughout the body. And also, as it releases oxygen, it can also, carry CO2 back as well. But extremely important that you have red cells in your body, and extremely important that you can oxygenate the different areas of your body. And so patients that have different diseases and disorders that are unable to make their red cells, or if they're bleeding red cells out continuously, they need red cell replacement. And so really, as a donor, you would take part in donating whole blood. Now, the next step for the plasma, some plasma can even be processed further into what we call cryoprecipitate. And cryoprecipitate is essentially, so this plasma is frozen, we thaw it, and the remaining precipitate from that thaw is what becomes cryoprecipitate. And within the cryo, you have very specific clotting factors that you need to help build a clot. So fibrinogen is one of the main indicators for cryoprecipitate, and several of our liver transplant patients or patients in liver failure, because their liver can no longer produce fibrinogen, they require cryoprecipitate transfusions. Now, the plasma itself contains all of the different factors. However, if you need very specific factors, then cryo is the way to go. And that's just a precipitate, as I mentioned before, of the actual liquid blood. So these are the, so cryo is the third component that can be produced from a whole blood unit. So just one donation, you can produce either packed red cells, liquid plasma, and or cryoprecipitate. Now, another component that we collect with our donor centers are platelets. The way we collect the platelets and the way that pretty much all of platelet collections are, how they take place in the US is using a machine, and the process is called apheresis. So essentially, there's a machine, there's a single arm needle that actually collects whole blood from our donor. And then within the machine, it spins the whole blood, and all of the blood, the red cells, and most of the liquid from your blood go back to you. And then we collect a bag of platelets and some of the plasma in the platelets, because the plasma essentially bathes the platelets. So we will collect a small portion of that, and everything else goes back to our donor. And this is called an apheresis process. So why do we need platelets, right? These are extremely important because if you have vessel wall damage or damage to your arteries or veins, platelets help form the clot. And it's actually the platelets, including those clotting factors from the plasma as well. But so you can see here, here's a clot that pretty much filled up this vessel here. And our platelets, when they're just circulating in our body, are nice and kind of uniform. But then when they're ready to clot, they activate until they get pseudopods, and they can form these balls together essentially, and that's where a clot would form. So several patients that either are not making their own platelets, or if you're hemorrhaging or undergoing a massive transfusion and bleeding out, you may need more platelets. And so we collect platelets in addition to whole blood for our patients. So why would you want to donate with UCLA? Well, UCLA Health has several hospitals. So we have the Reagan Medical Center, with, it has over 500 inpatient beds and ICU rooms. It's a level 1 trauma center, so we do have traumas that come through regularly. We also have our children's hospital, and then we also have the Santa Monica UCLA Medical Center Orthopedic Hospital as well. And there are 265 inpatient beds there. So, we have patients at several hospitals across both Santa Monica and Reagan and Mattel. And these patients require blood transfusions or sometimes platelet transfusions. So just the numbers, there's about 40,000 admissions annually. We have over 14,000 inpatient surgeries, including liver transplants, and liver transplants take several units of blood or several pints of blood to actually perform. We have over 24,000 outpatient surgeries, and then you see several emergency room visits as well. So we're a very busy health center, and we have a diverse patient population as well, and several of them require blood transfusion. So this is taken from 2019 data. It's slightly down from 2018 and 19, and blood collection slightly decreased by about 1,000 though for us for our collections over that fiscal year. But you can see that we collect over 20,000 whole blood. So that's would be through our centers or through blood drives. We can collect red cells through apheresis along with the concurrent platelet. And so with our apheresis platelets, over 10,000. And then we can also collect concurrent plasma or the liquid part of the blood with our platelets as well. So we have several collections, but when you look at the actual transfusions, there's a lot more transfusions than we're collecting. And Tom mentioned how, we're about 80% self-sufficient. So we really require other centers to help supply our patients as well. But, we'd love to have UCLA be 100% sufficient to supply our patients. So when you look at the total transfusions between the different hospitals, there's almost 30,000 red cell transfusions alone. For platelets, over 12,000, plasma, 11,000, and then that cryo that I mentioned before, about just close to 4,000. So we transfuse several blood products to our patients at the different UCLA health hospitals, and that's why we need your help. So I wanted to show you a little bit about what, how this kind of works. And in the past, we've had some labs. So we're going to try to recreate our lab experience here. But after the blood is collected from the donor center, then it's sent over to our components processing laboratory, which is held in the Center for Health Sciences, or CHS. And that's where we actually will process or fractionate. So from my previous slide, I showed that we would centrifuge and separate the liquid part from the red cell part. So that's what we refer to as fractionation. This is a picture of the blood actually being filtered. So this diamond shaped filter here is a leukoreduction filter, and that removes white cells from these red cell collected units here. And this machine here that I have, or this instrument here, is a somewhat new instrument that we have on board, and this is called pathogen reduction technologies or intercept technologies. And essentially for our apheresis platelets, we will collect them, and then in the processing laboratory, they undergo amotosalen, so a chemical is added, and then there's UV light that's added, and the chemical is actually removed in the step 3. And what that does is that it mitigates any type of infectious disease that could be there. So any cellular element, essentially, this process interleaks with the DNA, and it will essentially kill whatever could be growing there. So this is the safety that's built into blood collection and blood transfusion. So after leaving the components processing laboratory, then the units, after the testing results are negative and the units are no longer in quarantine, we send these units over to the blood bank in the hospitals. And within the blood bank, on the patient side, we will determine a patient's blood type. And also we will do a blood screen to look for any antibodies to red cells. And we will then provide matched units from our donor collected blood to what the patient receives. So you have to match both antigen and antibody from donor to patient. And then in the blood bank, we manage the patient blood needs. As I mentioned before, there's massive transfusion. We have NICUs in both Santa Monica and Reagan. And so sometimes neonatal transfusion occurs. Stem cell and solid organ transplant typically need blood transfusion because you are causing these patients to become immunosuppressed so that they can actually accept either their stem cell or their new organ. And so their bone marrow will stop making those cells that they normally would, and then they would be dependent on blood collected from donors and platelets collected from donors until their marrow builds up on its own. Hematology and oncology service. So if you think about just cancer patients in general undergoing chemotherapy, that is an immunosuppressant, right? And so they will require blood transfusions and platelet transfusions until they're gone into a remission and can make their own red cells and platelets again. And then for our operating rooms, there's often blood transfusions required for circuits, primarily like cardiac bypass. You know, you got to have the blood continually pumping. And if you're transplanting a heart or you're manipulating the heart, you still need blood available to pass through. And so we will send blood to those circuits that are attached to patients as they're undergoing the bypass. And then also other surgeries as well, several orthopedic surgeries. So sometimes knee replacement, hip replacement, things like that. Okay, so how can you be a partner with us? So Tom mentioned we have 2 donor centers, 2 fixed sites, one in Westwood. Here's a picture of it here, and the other in Ackerman Student Union. And here's a picture in Student Union there. And then you may see our van driving around from place to place because we have several mobile blood drives. And Tom is the best person to find out about all of the mobile blood drives and how you can partner with us. But you can see we have essentially patients all over we have places or satellites all over Southern California. And so we try to go along to some of these satellite places and collect blood from these centers as well. We had about 1,500 units a year from the different satellite sources of UCLA across Southern California. You will see and get emails from us regularly, especially in the time where there's critical shortages, which nationally we are experiencing that just due to the pandemic. You will also learn a little bit more about blood donation during the new hire orientation, or at least they used to when they were in person. I'm not really sure how they're managing them now. And then if you are interested, we can set up a blood drive at a clinic in the greater Los Angeles area. So how do you become a blood donor? A couple of things that we would require from you. First, you have to be over 110 pounds because of the amount of volume that we're taking off. We want to make sure that you are safe from having lost about 500 mils or so. We will take your vital signs and do a very mini physical. So your temperature has to be less than 99.5. And also we like to have a pulse greater than 50 beats per minute. And that's also to ensure your own safety. And the temperature is just to help determine whether or not you have some underlying infectious process that's going on. You should be feeling well on your day of donation with no cold or flu symptoms and no open cuts or wounds. And so if you think about the people that are actually receiving your blood donation, they are typically immunosuppressed and immunocompromised. So we need to have blood that is extremely safe for them. And that's why we have very strict guidelines in place just to ensure the patient's safety. And also in regard to hemoglobin, there are criteria as well. And that's for the donor safety, because we want to make sure that we're not causing our donors to become anemic by helping us on the patient side. Now, the donor center and transfusion medicine in general is the most regulated area within medicine. And so we are inspected by the FDA and ABB and California law as well. And so we do have some criteria in place that must be met in order for someone to donate. And that can include travel restrictions, different medications, medical or surgical history, and then high-risk behaviors that have been determined by the FDA. Now, what are the benefits of donating blood? Well, just knowing that every 3 seconds someone needs blood, you are actually helping save lives by donating blood. And as I demonstrated earlier, your donation can save up to 3 lives. And so really, by providing just a little bit of your time, you are directly impacting someone's life, in one of our UCLA hospitals. And I wanted to just add this blood type in the population here, just so that you're aware. There are different blood types, and so we need a variety of blood types for the patients that also have a variety of blood types. So it's great to have O, but we take all comers. So if you know you're A or if you're B, there's a place for you to donate. If you're AB, there's a place for you to donate platelets and plasma, in addition to red cells. So regardless of your blood type, we'd love to have you with us. And now I'm going to turn it over to our student representatives. So I'm going to exit my screen here. And then I guess we can take questions at the end. Okay, so next we have Mr. Wesley Wu, and he is a UCLA undergraduate student, and he is part of our Blood Bruin Initiative, which is an organization on our undergraduate campus, and he's been doing some wonderful work with us. And so he's going to share his experience while working with the Blood and Donor Center and as a blood donor as well.
Hi, so thank you, Dr. Ward, for introducing me. As she said, my name is Wesley Wu, and I'm a third-year undergraduate student at UCLA and also one of the co-presidents of Bruin Blood Initiative. So Bruin Blood Initiative, or BBI for short, is a club that works with the UCLA Blood and Platelet Center to really try to not only increase donor turnout and donor retention rate, but also raise awareness about blood-related health issues and just the overall importance of donating blood or platelets. So it's very interesting because when we ask our club members why they donate, we hear different stories. For example, some simply do it out of the kindness of their hearts, or some do it because their friends are donating. But others, like me, donate because we have family or friends who've had to receive blood transfusions in the past. For example, my mother had to receive blood transfusions in the past because when she gave birth to me, there were many complications that made her lose a lot of blood. I think it's all these interesting stories that really make up UCLA student body, but also make up BBI. And I think that we have to use these stories to try to encourage other new donors to come by to center, meet Tom, and donate blood and platelets. And then within BBI, we have a few different committees that try to help out center. So for example, we have a research committee that works with Dr. Ward and a few of her colleagues to really analyze the donor population's demographics and see trends, also compared to the undergraduate population's demographics. We have an education committee that really is all about using social media to really bring awareness about the different blood-related health issues. For example, recently we made an Instagram post about sickle cell disease and how it's very prevalent in America. And then lastly, we have an outreach committee, which is really about increasing donor turnout and donor retention rate. And to talk more about the outreach committee, we have Lauren Heiberg, who is the director of outreach, and she can also talk more about why she donates and why she's a part of BBI.
Hi everyone, my name is Lauren. I'm also an undergraduate student. I'm a second year, and like Wesley said, I help out with BBI's outreach committee. So I got involved with the UCLA Blood and Platelet Center because when I came into UCLA, I actually wasn't eligible to donate, and I wanted to find another way to help out. So I reached out to Tom, and he connected me with the students at BBI, and I found a community of people who also wanted to help out the Blood and Platelet Center. So my main job is, as I said, to help out with our outreach committee, which has 3 main projects, all of which their main goal is to increase the number of new and returning donors. So we work on social media, but in a little bit of a different context than the education committee. We do social media just to reach out to our donors. So things like donor spotlights, telling their stories, and then sharing events and promotions that we have going on at the Blood and Platelet Center. And then we're also working on some high school outreach programs. So creating Bruin Blood Initiative chapters at local high schools. We basically want to give the high schoolers the tools to run their own blood drives and give them mentorship from UCLA students. And then we also have a group of students who are working on donor engagement through incentives and events. So working on brainstorming ways to keep donors coming back, such as new incentives like shirts or new snacks. And then something else we like to work on is engaging with other UCLA organizations and departments by encouraging people to take part in the Lifesaver program. So this is a program where UCLA organizations and departments can run their own blood drives. And it's a great way to get students and staff engaged and to help out the Blood and Platelet Center. If you are interested in that, Tom will have a lot more information. But it's a great way that we get engaged with students and staff across UCLA. And in general, BBI has just been a great way to meet other people engaged with the Blood and Platelet Center and to be able to help out. And with that, I'll pass it off to Dean, who is the president of the University Blood Initiative.
Thank you, Lauren. Hi, everyone. I'm Dean. I'm currently a fourth year, also an undergraduate student majoring in neuroscience, and I'm president of UBI on campus, or the UCLA chapter of UBI, that is, which stands for University Blood Initiative. I knew nothing at all about donating blood. I never donated blood in my life, actually, until I joined UBI. I had a friend who was president at the time, and he was trying to increase his recruitment and everything. So I joined and donated blood for the first time. And I learned everything about it just through the organization and just learned how easy it was to do and how impactful it can be. So I donate now every 56 days, which is a positive improvement there for sure. In terms of our organization, UBI is linked to a nonprofit nationally. So there's different chapters at different universities across the nation, but our central goal is to increase blood donations that fell a lot with the absence of in-person workplace and school blood drives since the COVID-19 pandemic. So similar to kind of what UBI does, we also partner with organizations mainly on campus, whether it be student clubs, student organizations, club sports, D1 teams, pretty much any student organization on campus. Then we work with them to help them set up a blood drive and market their blood drive to get more blood donors and help first-time donors go through the process for the first time. One of our biggest events in the past, we're hoping to make it a yearly and maybe one day quarterly event. It's called the Week of Giving. While we typically try to organize blood drives with individual organizations, the Week of Giving last spring was kind of targeted at the larger UCLA undergraduate and graduate community for students, especially to try to pull in first-time donors and lock them in for life. So we did a bunch of incentive programs for that, and that turned out to be super successful. So it's a little bit about me and what I do, and I'm excited to keep doing it. And with that, I'll pass it back off to Tom.
Thank you all. And as you can see, you know, the work that we do takes a lot of people. But I think I'm super blessed to be in Ackerman because you have these amazing students, right, that bring us so much energy and joy in life, as well as so many of y'all in the different departments. And, you know, Staff Assembly did a drive with us for the first time during week 0, which was great. And, you know, so the way that we can continue, I think, as many of you maybe could even say for yourselves, that oftentimes it can be someone telling you about their experience, telling them it's not that bad, you know, and, you know, that you're treated well and fed well. And, you know, so I think maybe just for all of y'all that are here today, even for yourselves, if you haven't donated, or maybe part of today, just to reach out to one person and ask them to, you know, to come in. We are open. So our Ackerman hours and Gailey hours are different. And so there, you can find those on our website. And we, but generally appointments are recommended. We can take walk-ins at Ackerman, but it just depends. Like today we were completely full and we couldn't take any walk-ins. But so typically, even I encourage people like the morning of, let's say you're thinking, oh, maybe I could donate today, as opposed to walking in and maybe just give us a call. and see if we can, fit you in for that day. But anyway, so, the Gailey Center is open on Saturdays, the platelets only, except for the second Saturday of the month is whole blood. And we do, like we mentioned about the different drives that people sponsor. So we'll shout out to ASUCLA, who's doing a drive, Ackerman right after Thanksgiving as part of the Day of Giving, on the 30th. So that's exciting. So our partnerships are really, really critical. And we did a drive with one of the student groups last week, and almost half their donors were first-time donors. And that's another way that people come in, because they're like, okay, my peers are doing it, I don't have to go alone. And maybe that applies to y'all as well. So one of the things too, when we did this Learn at Lunch several years ago, and Dr. Ward showed the tour, kind of how we do it in the lab, we hope to be able to offer the in-person tours again. And so if that is something that interests you, I'll put my email or in the chat, but let me know, because then I organize those tours, and they'll probably be smaller to begin with than we normally do, but it's really amazing. And I know every time I go, I learn something new, and it's just kind of cool to see. So I also will share at the end, there's a QR code that you could scan if you'd like to make an appointment. But before then, just like to open it up for any questions that people might have for anybody that spoke. Or just
Hi, Tom.
general.
It's Desiree Womack.
Hi, Desiree.
I'd like to introduce myself. I'm Desiree Womack, and I work for Dining Services with Al Ferrone and Charles Wilcott and the other directors here. I also help coordinate the quarterly Housing and Hospitality blood drive here. And I was wondering if the slides that were shown earlier, if they will be available to look at, since I got a late start on the webinar.
I think we're also recording the session as well. So I can provide the slides. I'll send them to Tom, and he can distribute them to who
Yes,
needs them.
Desiree, in addition to that, the recording will be posted in the staff assembly webpage.
Great, thank you.
We had a great drive on November 1st, thanks to Desiree. It was really awesome, the drive we did with Housing and Hospitality. So thanks, Desiree, for all your work.
Thank you, Desiree. It's a quiet bunch. You can also type in the chat as well if you don't want to speak, and we can read the questions in the chat.
Hi, I'm a long-term donor, and I had a question about, is it possible to donate too much? Because I try to go every 8 weeks, and they've been telling me that they're having a hard time finding a vein sometimes, and that there may be some scar tissue now that's sort of built up. And the last time I donated, I had a lot of pain in my arm afterwards, which is unusual. So I don't want to stop donating, but I want to figure out a way to, is there something I should be doing, or something I should tell the guys when I donate, or what's your thoughts?
Sure. So the FDA does have periods in place for blood donation. So every 56 days for a whole blood donation. When you do that every 56 days, inherently, you will start to have a decrease in your hemoglobin, because it takes your body some time to rebuild those red cells. So the 56 days is what FDA provides to us, but unless you are taking a multivitamin with iron and eating a very iron-rich diet, if you do that every 56 days throughout the year, your hemoglobin can start to drop over time, and sometimes that causes people to be deferred. So I would encourage you to take a multivitamin after you donate. In regard to finding a vein, really it's just the volume of blood circulating. So we ask that our donors drink lots of water before they come in, you know, up to like 24 hours before they come to donate. And that helps just increase your overall blood volume. And with the veins, some people just have difficult veins and smaller veins. The folks that lift weights and do a lot of like, you know, handiwork usually have veins that are like the best and bulging. And so, you know, and then other people just have smaller veins. In regard to having challenges with the phlebotomy, I would just let your donor staff know when you come in, and maybe they could have, we do have some like expert phlebotomists in there, and maybe they could have one of our expert phlebotomists work with you to help with the phlebotomy to collect the blood. So I would just kind of let them know, you know, your experience that you've had in the past, and they can, you know, talk to someone, one of our charge nurses, to see if they can help with the phlebotomy. And I apologize for the stick that you had that caused some pain. That's something that we do not want to happen. Unfortunately, with blood donation, and anytime you're using a needle to either draw blood or donate blood, there's sometimes some adverse events that can occur with either bruising, or sometimes because the veins run alongside nerves, sometimes the nerve gets poked a little bit, and that can cause pain as well. So we try to prevent that at all costs, but unfortunately that does occur every so often. So I apologize for that, but I do thank you for coming to donate and continuing to donate. And so hopefully we can ensure that you have a pleasant experience when you come through.
There were a couple more questions that came through in the chat. So what are the medication restrictions for donation?
Sure. So there are a variety of medications. I don't know the list off the top of my head, but we do have that on our website. Some of the medications are like hormonal, and so we would defer, because if a woman that's pregnant gets a transfusion, you know, with some of the medications that can influence hormones, that could essentially affect the fetus. So there's some of those. If you're donating like platelets, if you're like on an anti-platelet medication, that would be something that we wouldn't want, because then essentially your platelets wouldn't act as aggressively as we'd like them to for transfusion and for patients. So there's a variety of medications. We do have a list that is posted on our website, because we want you to be aware of those medications before you come in to donate. And you know, it really just depends on the mechanism of action for the medication. There's not a lot of medications when you think about all the drugs that we can take that are available, but there are a few that are well known that can be problematic for patients.
Great, thank you. Go ahead, Tom.
Sure, I'll address that. I saw the other question there too. So yeah, we do offer, there's times that we offer different incentives for people to come in. And one of the things that I know a lot of staff, not everyone can qualify, but staff can receive 4 hours of blood time, but it really depends. There's some people that cannot receive the blood time. So we often encourage people to talk to their HR to see if they're eligible for that. But as I mentioned earlier, we have lots of good, you know, snacks. And Becca, who's on here, is a big Cool Ranch Dorito fan. So, you know, whatever brings you in, right? But we also sometimes have different promotions throughout the year, especially during some of our kind of slower months like January and the summer. Some of you who are regular donors might remember some of those. But yeah, so those are some of the things that we offer, in addition just to a great experience, a great staff. I like to dance a lot when I'm in the center. There's lots of reasons to come in.
Yeah, I think like myself, I don't qualify for the staff comp time, and I don't think any of the physicians at UCLA do, and a lot of people on the health side do not. But then I get a cool T-shirt, so that's always fun. You know, I like to kind of wear my T-shirts outside of work, and people stop and ask me questions. And so yeah, we have a lot of cool things that come through. The sweatshirts are always a big hit. I think I'm gonna have to set up an appointment this year to get a sweatshirt, because every time I try to come in to donate, they're always gone by the time I get on the book. So yeah, so unfortunately not everyone gets the comp time, but if you do, that's great. And if you don't, you can, you know, get some other cool things as well.
And the other thing I'd mention too is that we do have the opportunity for people to donate their gifts to Swipe Out for Hunger or to Bruin Shelter. And Bruin Shelter this year, it's really awesome. So if y'all know, it's a shelter for college students. They don't have to be UCLA students. It's in Santa Monica, and they're very close to our hospital there. And so there are any donated meal vouchers. So we offer a $7 meal voucher to the cafeterias at Reagan or Santa Monica, and the students are going to give those to some of the residents. If people donate it, we're going to be able to give them that, or they can get food from Reagan, like they can order food and use it at the shelter. So it's pretty awesome. So those are other ways too, as well. And then Dr. Ward, there's a question about vaccinations.
Sure. Let's see. What is the question?
Just restrictions. Definitely, I know usually people ask about flu and COVID.
Right. So there's no true deferral with the vaccinations. We do ask that when you come in, you feel like well and are healthy. And I know sometimes with the vaccines, especially, I know for me, in my experience with my COVID vaccine, I was kind of like out for the count for one day. So that would not be a day like I would come in to donate. But other than that, there's no restrictions or deferrals for the vaccines. We were running a campaign collecting convalescent plasma. That's no longer in place. When that was in place, there were some restrictions for the COVID vaccine at that time. But as I mentioned, we're no longer collecting the convalescent plasma, the COVID convalescent plasma. And so if you have your booster or you're getting your first few doses of your COVID vaccine, it's not an issue. If you're getting your flu shot, not an issue. But you do want to feel well before you come in.
Any other questions for the panel? All right.
One thing I'd like to just quickly share, Tom, go ahead and put that up, is that if you have like needle phobia or just, very anxious and not someone that thinks they can donate blood, that is completely okay. What I would ask from you is to ask a friend, maybe to donate on your behalf, or just to, share that we have a blood donor center on our campus to bring more donors in. So I completely understand not everyone is that perfect person to donate blood, but if you can share the news with other people to bring other donors in, we appreciate that just as much. And we thank you all that donate blood that are here on the call with us today. I personally thank you from the bottom of my heart. You guys make my life a lot easier on the patient side of things, and when we have blood available for patients. And I know that on the donor side, we definitely appreciate you as well. And our patients appreciate you.
All right, well, thank you. Thank you, everyone. Thank you, Dr. Ward. Thank you, Tom, Wesley, Dean, and who am I forgetting?
And Lauren.
Thank you so much for your time today and for explaining the process to us. And everyone, we put in information on the chat about how to make appointments. And also Tom, just hopefully you were able to get a picture of that. But Tom, if you could send me the QR code, we can also post that up in the staff assembly site.
Great.
Great.
Yeah.
All right. Well, thank you, everyone. And see you at the next Learn at Lunch.
Thank you.
Okay, take care.